बहुत ही अच्छा इवेंट था। मैंने इसमें हिस्सा लेकर बहुत कुछ सीखा। और जब बात होती है ब्रेस्ट कैंसर की तो सबसे ज़्यादा इम्पोर्टेंट बात है अवेयरनेस, अर्ली डिटेक्शन। और जाइडस ने एक बहुत ही ब्यूटीफुल इनिशिएटिव लॉन्च किया है, अवेयरनेस कैंपेन लॉन्च किया है कॉल्ड द ईजीएस्ट एग्ज़ाम। तो इट वाज ऑल अ पार्ट ऑफ टुडेज़ प्रोसीडिंग्स। और यहाँ आकर मुझे बहुत अच्छा लगा एंड आई रियली एंजॉयड मॉडरेटिंग द पैनल एज वेल। एंड मैं आई कंसिडर माई सेल्फ वेरी प्रिविलेज टू बी अ पार्ट ऑफ इवेंट्स लाइक दिस। थैंक यू।
ऑल्सो मैम, ये अवेयरनेस लोगों तक पहुंचाना कितना इम्पोर्टेंट है?
ये अवेयरनेस ही है, देयर इज़ नथिंग एल्स, इट्स ओनली अवेयरनेस। वी डोंट हैव अवेयरनेस, awareness is the key as far as cancer is concerned. Early detection means good results, means successful treatments. तो अवेयरनेस इज़ द मोस्ट इम्पॉर्टेंट। और ब्रेस्ट कैंसर के बारे में मैंने काफ़ी सारे फैक्ट्स आज जाने। एक तो 1 in 28 women in India are likely to get or to be affected by breast cancer. So self-examination is where you can detect it early, and that's key.
Thank you so much.
What are your thoughts on Zydus' breast cancer campaign? What would be the potential impact of such a campaign?
So, as you heard on the dais, what has happened currently is when we talk that in India only 1 in 28 patients, women, are diagnosed with breast cancer. The world rate is 1 in 8. Now the question we need to ask ourselves is it really 1 in 28 in India, or are we missing those women who get diagnosed at stage 4, stage 3, or are the resources not there? So I am very thankful to Zydus for coming up with this campaign where every single woman, with resources, without resources, can just, as per her menstrual cycle, every month check for the changes in her body and report and raise an alarm if need be, and we can save so many women, because 90,000 women to lose in a single year is not a small number. We need more women in this society, and we are raised and loved and cared for by women. So thank you, Zydus, for this wonderful campaign, and I hope it reaches as many females as it can. I hope more males take it to the females in their households, and hope we eradicate the taboo about breast cancer. Thank you, Zydus.
What the panelists said, that counseling is very important. And to start with, how to make the patient be open for counseling, create awareness. And these kind of programs are really initiating awareness for breast cancer, and that makes it easy, the path easy for an oncopsychotherapist, that is myself. And I would like to say that what is being a fad now of precision medicine, psychotherapy for counseling, we are practicing since last 10 years in our center, that is N.K. Dabur Cancer Foundation. On Care is running a program for patients doing art therapy, music, dance therapy. Dr. Khurshid is managing in that. I think you can...
So once again, coming back to the importance of early diagnosis, it's absolutely important. As part of our campaign, we travel into rural areas with, trying to detect breast cancer, especially at a very early stage. We have different methods of diagnosing. Of course, your self-breast exam is the best, but one step more, like with technology, is we have the iBreast machines. We have different techniques now for early detection, which can then be followed up by mammography and other techniques. And post that, like a lot of people said, the denial, and to convince the people to kind of come out, take the treatment, which is very, very affordable and doable now, is very important. Because even after seeing a lump or after feeling a lump, the scare and the social stigma prevents ladies from coming up and taking the right treatment. So I am Dr. Khurshid Mistry, part of N.K. Dabur Cancer Foundation, and running the palliative and supportive care center called On Care.
And I'm Dr. Paru Dabur. I'm an oncopsychotherapist working with cancer patients.
Thank you.
Shruti Arora, medical oncologist and hemato-oncologist at Nanavati Max, consultant and at Empire Bandra.
Ma'am, tell us about the initiative taken by Zydus and what
I-
is your view on that, and how much is it important to take the initiative to aware the people?
So I think Zydus has taken it is a very important initiative which Zydus is taking, because now also we see a lot of patients coming to us very late, people not talking about this, people not being aware that a painless lump can actually be something so severe in later life. And I think so it is a very good initiative to talk about. The more you talk about things, the more awareness that you spread. And it not only spoke about patient awareness but what the caregivers go through. So it was quite a holistic approach. Apart from treatment, taking the psychological support of the patients, other financial supports of the patient, getting innovation in it. So I think so Zydus is doing a fantastic job, and bringing everyone together is really commendable.
Thank you.
So breast cancer society is the most common cancer in women, not only in the world but in India. If you read the stats of Globacon 2020, 1 in every 29 women will have breast cancer, and the rates go higher by 2025. So, and the death rates from this disease is also amongst the top 5. So I think so awareness about this disease, which can be easily detected, where the cure rates can cross 90% if detected early, is something which would really bring down the burden even to the healthcare system of the country. Thank you.
Thank you. Thank you, ma'am.
Okay. Good evening. I am Dr. Shyam Agrawal. I am a medical oncologist and director of Navodaya Cancer Hospital. Today I am very enthralled to see this event because it is very close to my heart. I am working in oncology since last 25 years, but this is the event which really touched me. We lose so many women just because of simple small lump in the breast. But it is so aggressive because they say breast cancer is the systemic disease right from its inception. And people neglect it. They say it's a very simple small lump, how can it kill me? But definitely it metastasizes so fast that it can go to the lungs and livers and brains, and we have a devastated death of the lady. And the good news is we have very good treatment. We have targeted treatment, we have ADCs, we have immunotherapy, and we have early diagnosis by PET scan, mammography, and all what they have. So definitely I message all the women to do breast examination every year, as the easiest examination has been pushed off. And then if anything is abnormal, then definitely go to your doctor and get it checked. Don't delay, because delay can kill you. Thank you. The most important one is the thickening of the breast skin, or there is a lump. If you do a regular breast self-examination, you will come to know. Because the whole idea of this easiest examination is that you should be aware of your breast structure, uski feeling, and then how it changes over a period of time. Normally in the menses time, the breast becomes thicker. But once the menses are over, then it becomes supple and soft. That is why you should be aware of the tactile sensation of your breast every month. And the age you grow, then definitely there will be further changes. So that is what the easiest examination is, to make you the futuristic changes in breast. And if any time you feel that there is a lump, there is a thickening, there is a discharge in the nipple, then definitely you should report to your doctor, because you cannot now and then go to your doctor. So you make yourself aware of your breast feelings and then detect it early. Thank you very much.
I'm Dr. Ganapati Bhatt, medical oncologist from Jastok Hospital, Mumbai.
What advice would you give to women for reducing their risk to developing breast cancer? For example, lifestyle changes, a healthier diet, and no exercise.
So for the female, that the awareness of the breast cancer is important, and the healthy lifestyle, weight reduction, and those who are having the already family risk factors, they should have the checkup earlier. And modification of the lifestyle is very important, and reducing the weight and the healthy lifestyle adoption is very important in breast cancer. And also the self breast examination is one of the tool in preventing the breast cancer in the early stages.
Thank you, sir. Thank you so much.
Ahmad, Asha Cancer Hospital, Thane. I'm a cancer specialist practicing for more than 25 years. Breast self-examination is the most important and the simple thing which all women at all ages should start. Whatever anyone says, from the age, once the breast is developed, the ladies should know their own breast, and any change from the difference like forming a lump, a nipple retraction, or a mass in the axilla, one should go to the doctor immediately. One should not compare one's breast with anyone else's breast, and you should always remember that those breasts are normal for you, and don't compare with anyone else's breast. And remember that because you are your own person, don't be shy, and 3 minutes after your periods, or those who don't get periods, do it, fix a date, and on that day do the breast self-examination.
Thank you, sir. Thank you so much.
Start?
Yes.
Hi, I am Dr. Prasad Narayanan. I am the Director of Medical Oncology at Sidecare Hospitals in Bangalore.
What are your thoughts on the Zydus Lifesciences breast cancer campaign and its potential impact?
Yeah, this is a very right time for a breast cancer campaign. This is the Breast Cancer Awareness Month. So Zydus is focusing on early breast cancer detection, and the focus is on self-breast examination. I think that is a very important campaign, and we know that there is 16% is the incidence of breast cancer in India now, and it is the most common cancer among women. So I congratulate Zydus for this initiative, and it's a very important initiative. A 3-minute self-breast examination can help in detecting breast cancers early, which is a very significant thing for our country.
Thank you, sir.
Thanks.
To Uma Dangi, I'm a medical oncologist.
How do you believe the stories of breast cancer survivors, like those who died and stories of hope, contribute to patient care and public awareness?
So I think it's a very excellent initiative. The stories of hope, always when patients come to us, when a doctor tells them something, it's always different. And when a patient, somebody who's actually gone through the entire procedure, talks to them, it's always a different experience. So definitely, reading about all these stories where women have survived the disease and come out, it's going to be inspirational for all the patients, and definitely launching this book is going to create a lot of awareness.
Thank you, ma'am.
Thanks.
So I introduce first?
Yeah.
Okay. Hi, this is Millie Barua. I am from Bangalore. I work at Sidecare Hospital as a mind and body wellness and yoga therapist.
During the treatment, you must have gone through a number of challenges. How did you manage it?
Yeah, so a lot of challenges, definitely. But if your mind has to be really strong, once your mind is strong and you accept it, first acceptance is very, very important. Once you accept it, everything is easier. Including that, your family support is also very important. Once you have a good family support and good doctors and your mind is set, then definitely it is easier. So I urge all of you to have a very good family support and the doctor's support, and always listen to the doctors and go ahead with the treatment, complete and compliant.
Thank you, ma'am. Thank you.
What are your thoughts on Zydus breast cancer campaign and its potential impact?
The campaign addresses something really important, that is being self-aware, being aware that there could be something wrong with you and identifying about it in the very early stages. So identification and knowledge is the first step. So if you're not aware and you don't have the right information, I don't think the right procedures and medical treatments can be done and taken forward. So the self-awareness initiative that Zydus has launched is truly remarkable, because without being worried, constantly you can do a self-assessment, and that assessment can happen from your very home. It can be regular, and that will actually allow you understand your health, and in case there is some worry that does crop up, you can obviously do and take medical help and information from your right doctors.
Thank you, ma'am. Thank you so
Thank you.
Me, Dr. Pushpak Chirmade. I am a consultant oncologist practicing in Navi Mumbai and Thane. So family history is a very important part of breast cancer. But mind you, not all cases are family history related. So out of 100 cases of breast cancer, maybe 10 are related to family history. In that, also significant family history, that is if you have more than 2 relatives, first or second degree, if they are positive for breast or ovarian cancer, then you need to be worried. So consult your oncologist and your doctor to know the chances and the risks of your family history. Thank you, sir.